Alright, so in this video we're going to be doing the cross-fibering recipe for the anterior leg. Before we get started, when your client's on the table in a face-up posture, when their legs are flat on the table, if they ever feel like there's any tension or discomfort, especially in their low back, it's a good opportunity for you to go ahead and use a bolster underneath the knees. A lot of times it'll relieve that area. Today we're going to go ahead and proceed without a bolster. Our first move today is actually going to be addressing the quadriceps, but before we get started we're going to have to undrape the first leg. So here we go. And as we're making the drape in the front of the leg in particular, I usually make an effort to bring the drape very high up and make sure that it's circling over the top of the Anterior Superior Iliac Spine, or the ASIS. When you get that spot showing, it's much easier to access the AIIS, which is our first spot today. We're going to contact the AIIS at the origin of rectus femoris, and we're going to start to cross fiber here. I'm using my finger pads, but you could potentially also use your short knuckles, regular knuckles, or possibly even an ulna. Just be mindful that this spot in particular tends to be quite tender, so you don't need to use a lot of pressure on it. I'm using a bow stance in this move. Front foot's pointed forward, back foot's pointed off to 45 degrees. Once we've cross-fibered the origin, we can come down, making a few more contacts along the leg as we approach the knee. You'll notice that I kind of took my offhand and grasped the leg. Occasionally you might feel like as you're cross-fibering, the leg is a little wobbly. If it feels like that's getting in the way, you can use your second hand to secure the leg. And when we get down to the knee, we want to think about the 3 points of insertion for all the quadriceps. We start with the tendon that approaches the patella. So I'll cross-fiber that tendon just proximal. Then we'll come through the patella down to the patellar ligament. This is just distal, which connects into the tibial tuberosity right here. Okay, so we've gotten our first muscle. Rectus femoris is finished. We're going to come back up the leg. Second muscle we're going to address is going to be the vastus intermedius. Now this muscle is actually deep to the rectus femoris. So the first cross fiber we did is going to be in the same spot, but our pressure is going to have to go deeper to get to the vastus intermedius. When you make contact, you want to make sure that you're taking the time to let your pressure sink down until you feel like you're on the surface of the bone. Once you're there, you can go ahead and begin your cross fiber again. This time your pressure is deep enough to affect the deeper muscle, the vastus intermedius. How's your pressure today?
Great.
Awesome, thank you. Cool. So I mentioned this in other cross-fibering recipes, but as you're working with your partner, you want to make sure that you can consistently get to at least a medium intensity, classically like a 4 or 5 on a 10 scale. A lot of times professionally you'll have to do a higher intensity. People will expect that, so they might expect you to do a 6 or a 7. But when you're first learning, it can be helpful to not be quite as aggressive until you've got a better feel for the technique. So again, I've taken vastus intermedius all the way down to the knee. It's the same 3 insertions. Since I already got the 3 insertions, I'm going to go ahead and move back up the leg. Our third target is going to be vastus medialis. Now this muscle actually wraps around from the linea aspera, which is behind the femur. If we want to contact this muscle, what we're going to do is we're going to come from the center, just a little bit more medial. We're going to place our hand and lightly push in until we feel our pressure again is coming down towards the bone. That's going to put us in a good spot to contact the vastus medialis. And just like before, I'm going to go ahead and cross fiber using 3 or 4 different contact spots here. As I'm doing this, I'm looking for anything that I can sense, any tension spots, any ropey or stringy lines that I might be able to focus on. And you'll also notice that as I'm doing this movement, my elbow is not bending and unbending. You can see that my movement's coming out of my stance. I'm lightly rocking between my front and back leg. As medialis comes into the knee, it's going to circle around and click into the front and center again. Last muscle we're going to be addressing here, as part of the quadriceps, is vastus lateralis. It's the largest of the quadriceps. In addition to coming off the linea aspera from the posterior femur, just like the vastus medialis, this muscle is so big that it actually has an origin on the greater trochanter as well. So a lot of times before I start here, I'll palpate greater trochanter, go just inferior of it, and think that this is a quadricep spot, so this is often a good spot to treat as well. So we'll go ahead and start cross-fibering vastus lateralis. Coming down the leg. If you feel like that wobbliness is getting in the way, or if you feel like sometimes I'll just turn the leg to kind of help face the lateral leg up to me. And then we can do that to kind of make them move easier. And again, making several contacts here. I'm going to do maybe 3 or 4, but vastus lateralis is so big you could probably find some more if you wanted to. And take it all the way down into its insertion. Again, it tends to wind around into the front and center, clicking in here at the tendon, through the patella, onto the patellar ligament, and the tibial tuberosity to finish. Great, so we've got all 4 quadriceps. We're ready to move on to our next set. All right, so we're ready for the next set of muscles. We're going to be addressing the adductors next. Now the adductors we know are predominantly, of course, on the medial inside of the leg. One of the adductors, the pectineus, is actually a little bit higher up and a little bit more forward facing. If we're going to cross fiber pectineus, we're going to actually be almost on the anterior surface of the leg, just outside the boundary of the sheet or of our drape here. And as we press in, we can do a light cross fibering in this spot. Oftentimes, the direction for pectineus can actually be a little bit more diagonal and down the table. So we can set our bow stance here just for this muscle, creating a cross fiber for pectineus. A lot of times when people feel like if they've pulled their groin or strained that area, it's often the pectineus. So this is a good spot to be familiar with. Once we've done this particular adductor, the rest of the adductors, we're going to change our bow stance to facing directly across the table. The rest of our adductors are pretty much just going to be straight going this way. What I will do is I'll come in underneath the drape, pull the adductors back like I'm trying to pin them on the femur, and then initiate a cross fiber. Now sometimes as a student, if you're doing this and you're noticing that the leg is starting to get pulled off the table, what you want to do is you just want to decrease the amount of pressure that you're using to pull into the leg, and instead of using a really broad contact tool, you can make a slightly more pointy contact tool, and then you don't have to pull as hard. So if you are pulling the leg off the table and you're finding that to be a problem, just use less power and a little bit more of a pointy tool. Should fix that problem right up. So high up on the adductors, we're working mostly on adductor brevis. As we come down the midway point, we're going to start to get into more of the adductor longus. And in particular, as we approach the knee, this is the terrain where we're going to be mostly on either gracilis or adductor magnus. Adductor magnus tends to be a little bit more posterior. Gracilis tends to be just a little tiny bit more anterior. And we're going to cross fiber as low as the medial proximal tibia. This is the insertion point of the gracilis, so we want to come all the way down onto that insertion. Boom. And we've got our cross fibers, or rather I should say we have our adductors cross fibered. So we're ready to move on. Okay, so since we finished the adductors on the medial side of the leg, the next spot we're going to focus on is on the lateral part. So what we're going to be doing now is on TFL or tensor fascia lata and the iliotibial tract or IT band. Just like in the first recipe, we're actually going to go ahead and use a hip locked elbow here. My bow stance is mostly going to go across the table, and I'm going to try to lock my elbow securely in kind of the crook of my hip and use my punching knuckles to come in and contact the TFL. To find TFL, just remember it's usually helpful to palpate the front of ASIS and then simply trace your finger onto the back side of it, where you're going to find TFL just underneath or just distal of the iliac crest. So now that we've found it, we'll go ahead and lock the elbow, bringing the knuckles into the spot. I use my stance to push forward, and then I use my stance to create a light bounce for this cross fiber. A lot of times while I'm doing this cross fiber this way, I actually really push my knuckles forward to make the contact a little bit more intense. But if you feel like you've got too much intensity, you can kind of let the knuckles be a little softer. Typically, I can find space for 2 contacts for TFL before I move on. So I'm going to make sure that TFL gets a lot of attention. It's the muscular aspect. So when the IT band is tight, it's the muscle of the TFL that typically pulls on it to make it tight. So focusing more on the muscle can be very helpful here. Once we've got the TFL, we'll go ahead and move. We can make a soft contact over the greater trochanter if we like, and then a slightly deeper contact for the rest of the IT band coming down the leg. I'm going to actually back off, and instead of using a hip-locked elbow, I'm just going to use an extended hand with a soft knuckles fist. Cool. And remembering that the IT band, again, it crosses the knee, so we're not done with this movement until our pressure and our movement has also crossed the knee. Good. And as I feel like the joint of the knee, just on the other side is going to be the insertion or the end of the IT band. And with that, we finish this particular muscle. So we're ready to move on. Great. So the next muscles that we're actually going to be working on are going to be the, what we say are the agonists of hip flexion. So we're going to be looking at psoas and iliacus. We're actually going to address these two separately, even though they're sometimes grouped together as one single muscle, the iliopsoas. So when we come to approach the body for psoas in particular, what I'm going to do is I'm going to take the time to palpate two different spots. The first one I'm looking for is umbilicus, or just simply the belly button. So right about here. And then the second spot we're looking for is the top, or the most anterior part of ASIS. Now once I've made those two contacts on the body, I'm going to make an imaginary line between them, and about halfway through that line, this is about the spot that we're going to enter to access the psoas. So when we do try to access the psoas, I want you to remember that some people, this move takes a long time. It can take several minutes, and for some people you might not actually get as deep as the psoas. But still, there are other clients where you'll go in and you'll be there in 10 or 20 seconds and it'll be a real simple thing. So just know that this move varies a lot by the client, and so sometimes it's very quick, sometimes it can be much more difficult to access. When we do try to press in, we're going to take our pressure first down and then we're going to turn it towards the psoas. So we're going to kind of treat it like the capital letter J. We're going to go down first and then we're going to turn in to aim our pressure in towards the psoas. As we're doing this, we want to treat it kind of like a deep tissue move where we're going to be a little bit slower. We want to try to follow their breath, so especially on their exhales, we can get a little bit deeper each time. Remember to be patient. How's our pressure so far?
Good.
All right, very cool. So again, I've sunk in probably about 1 inch to 1.5 inches down. Now I'm going to take my pressure and I'm going to start to slide it forward. Now you'll know, basically the best way to tell that you're actually touching the psoas is the front of your fingertips are going to hit a wall, and it'll probably feel pretty hard. This could be the psoas. If you want to check and see if it truly is the psoas, a lot of times you can ask the client to make a small movement. Typically I'll say, go ahead and just flinch your knee like you were going to bring it towards your chest. Great, go ahead and set it back down. And if you feel the muscle pull or tighten underneath your fingertips pressure, then you know that you're going to be on the right muscle. So now that we're there, we can go ahead and initiate a cross fiber. Again, my bow stance the whole time has been forward and across the table. I'm going to go ahead and kind of start easy and make sure that the movement and the doesn't create too much pressure for the client. And while I'm cross fibering here, I have a couple options. This first contact, of course, gets us right at about the L3, L4 area. I have the potential where I can take my bow stance and I can turn it a little bit up the table. This way my pressure can sometimes address the higher parts of psoas closer to the L2, possibly L1 area. I can also take my pressure and aim it just a little bit down the table, changing my stance this way. And that'll help me to aim down towards the L4, L5 area of psoas. Once I've gotten this area cross-fibered, I'm going to go ahead and try to go a little bit more slowly on the way out. Again, we want to treat this kind of like a deep tissue technique where we don't just pull our hand right out, but kind of give the body a chance to kind of shift as we remove the pressure. So we've got psoas. The second muscle that we're going to be looking at here is iliacus. Best way to start to access iliacus is just to palpate the ASIS. Once you have the ASIS, what we're going to do is we're going to go just superior of it, and we're going to feel the iliac crest. When we feel the iliac crest, what we want to think about is we're going to follow the crest and we're going to dip straight into the bowl. So just remember, you're going to feel the crest, and you kind of want to pull your fingers back to hug onto the surface of the wall as you ride down into the iliacus. My bow stance, again, is going to be mostly across the table, just basically front foot facing directly across. I'm actually using my fingers to lightly pull back, so that way I'm kind of hugging the wall of the iliac crest. And again, just respect that this area can be quite sensitive, sometimes even ticklish. So just be mindful of your client's intensity and how they can accept, or if they can accept, this particular movement. Cool. Now, technically, there's a lot of spots that we can get into. Most of the time that you work on iliacus here, you're going to find that it's not easy to go very deep here. Oftentimes, people are pretty solid up in this spot. So don't be thrown off if you can't get really deep into the muscle. Follow it as low as you can, and when it feels like you've sunk as far as you can, go ahead and initiate a light cross fiber here. Now, part of the reason that we're going superior around the ASIS is just remember that there's actually the inguinal ligament that goes between the pubic crest and the ASIS. It's not particularly harmful, but it can be uncomfortable if you put pressure on that ligament. So that's why we go over the top and not through that spot in particular. So I'm going to go ahead and start to create my separation here coming out of iliacus. I'm going to give you one more recommendation. If you're working on either psoas or iliacus and you're finding that you really can't get access and you want to try to do something to help yourself get a little bit deeper or be able to do this, this move just more accessible to the client, a lot of times what you can do is you can bend the knee. So just make sure that when you do that, you're keeping the drape snug. We'll bring the knee up to a flexed knee. That flexes the hip as well. It makes all these muscles a little bit shorter, and that usually makes them a bit softer and a little bit easier for the client to accept pressure in these spots. Once we have it here, we can use the same spots touching the ASIS, going down onto the iliac crest, or we can use that same measurement to access the psoas halfway between belly button and ASIS, pressing our pressure down like a J and then turning in. So again, you can do these techniques with the hip flexed or with the hip straight. Just check and see which one is easier for you. Great, we're ready to move on to the next move set. Great, so the next moves that we're going to be focused on, or the next muscles, are going to be the tibialis anterior and the fibularis muscles. This is on the distal leg. So first thing that we're going to be doing is addressing tibialis anterior. Usually when I'm going to do this move, I'm going to take my bow stance, face it directly across the table, front foot goes in the direction of my push. In this particular case, it usually is helpful to give the leg a little bit of a medial rotation, and what that'll do is it'll help to bring the tibialis anterior as well as the fibularis muscles more to facing upwards, and that should make them easier to access for you. So this hand might actually hold the leg into a medial rotation while the first hand goes through. Tibialis anterior, we're looking for our first contacts right here on the anterior and lateral condyle of the tibia, coming down the shaft, and just kind of feeling for all of the squishy parts of this muscle. So making, just like we usually do, 3 to 4 contacts as we're moving down. Tibialis anterior, when it gets to the ankle, it actually crosses over towards the medial side. So even though most of tibialis anterior is on the lateral side of the calf, as we get towards the ankle right about here, we're going to feel that the tendon is starting to sneak across onto the medial aspect. So if we want to be really attentive, we can follow that tendon a little bit over the front of the ankle and onto the medial side. When we're ready, we're going to come back up the leg and we're going to look at the fibularis muscles next. Now, like I mentioned before, the fibularis muscles are right on top of the fibula. If you don't feel the bone, the ridge of bone of the fibula under your pressure, you're probably missing this muscle. So be mindful of that. I'm going to go ahead and use my knuckles kind of in a horizontal spread to kind of capture this and be able to cross fiber it here. And these two muscles, in truth, they were right next to each other. I say they're next door neighbors, and so they do sometimes get stuck on each other, adhesed. And because they're kind of antagonists, they do the opposite movements. So if you ever feel like you feel these two muscles stuck together, it's usually going to serve the client for you to try to release that adhesion. The fibularis muscles do not cross like the tibialis anterior does. It flows straight down the side of the leg, and you can follow this muscle all the way onto, or just behind, the lateral malleolus, or the lateral ankle bone. And you notice that I switched out from using my knuckles into using kind of my fingers here, because as we get close to that bony spot, it can become quite a bit more tender. All right, so now we've gotten tibialis anterior and the fibularis muscles, we're ready to move on into the ankle. All right, so we're ready to do the last part of our cross-fibering recipe on the anterior leg. We're going to be addressing the ankle and the foot. First thing that we're going to be doing is working on what we call the retinaculum. The retinaculum is actually just an extra thick part of connective tissue that wraps around the ankle. Essentially, part of its function is, go ahead and flex the foot upwards. You see that the tendon comes through here. Go ahead and relax. Part of the job of the retinaculum is to actually hold the tendons back into the leg so when we lift the foot up, they don't come flying away from the foot. So that's part of what the retinaculum does. It provides stability and support to the ankle as well. The thing to remember about the retinaculum is that it's not a muscular tissue, it's a very fascial tissue. That means it has less blood flow than a muscle and less warmth. When we think about working on fascial tissues in bony areas, particularly the ankle and the foot, a lot of what's going to help that fascia to change faster is if you can bring a little bit of heat into it. So for this reason, usually when I work on the retinaculum, typically what I'll do is I'll actually take some time to do a little bit of frictionally rub to bring some warmth into this tissue. And then when I feel like there's substantial warmth kind of in the front of the ankle, what we'll do then is we'll come back, placing our bow stance across the table. And you can kind of see here, I'm not really using my fingers so much as I'm using like heavy palms, and I'm just kind of trying to mash and stretch the retinaculum left and right. I can use kind of twisty movements, almost like if you were going to grab somebody's arm and twist it and give them a friction burn. We can do a little bit of that type of movement without getting it carried away, and we won't cause any damage. And so we just want to work over onto the medial ankle, over the front of the ankle, and a little bit over the lateral ankle. And just feel like we're stretching out those fascial tissues, the retinaculum, over the ankle. Once we've done that, our last move here is going to be working on the dorsal surface of the foot. Same thing applies here. There's not a lot of muscular tissue here. It tends to be a lot more bony and fascial. So we're going to just try to see if we can make sure that it's nice and warm. And a lot of times in these more bony areas, instead of using pointy tools like fingertips, I'll often use bigger blanketing tools like a broad palm. And again, just kind of stretching across the body, trying to use my stance to create my push as much as possible. And as much as I can, just trying to get all the surfaces of the dorsal side of the foot. A lot of it I focus a little closer to the ankle, but I can bring all of that attention down towards the phalanges or towards the toes as well. Great. And with that, we've finished our cross-fibering recipe for the first leg. So what we would do next, of course, is to redrape this part of the body, go to the second side, and do this recipe again for the second side of the body. All right, so we're here. We're going to be doing the circulatory or advanced circulatory recipe for the anterior leg. We have our client laying face up, so we'll go ahead and get started. Our first muscle group is going to be the quadriceps today. So we're going to go ahead and take the drape back. When you're doing your drape, try to make sure that you're exposing as much of the muscular areas as you can. You don't want to have to work underneath your drape. In fact, you should never really work underneath your drape. So you'll notice that I've really made a big effort to bring most of the leg out from under the drape. So try to make sure that you're doing a nice clean drape here. Once we have that done, we'll go ahead and use our lotion or oil and effleurage over the surfaces that we're going to be working on. And again, our first muscle group here is going to be the quadriceps. We're going to be using our 5 strokes as per usual. So we're going to start with our palm. My bow stance again, my front foot facing in the same direction as my push. As I do my palming strokes, I want to make sure instead of just getting the same spot over and over and over again, that I'm doing a little bit of the medial part of the quadriceps, that I'm doing a little bit of the lateral part of the quadriceps. So make sure you're covering everything. Then switch to your knuckles. Good. Some of the medial parts of the quads, some of the lateral parts of the quads. You'll notice that I switch hands. One hand gets the side, the lateral part, and one hand gets the medial part a little easier. Let's go to our trench. Trench is pointy with a lifted palm. It doesn't have to be very heavy pressure. Good, coming out over the lateral quadriceps. Then we're going to do our thumbs. Good, oftentimes as I get close to the drape, I'll pull my fingers back, so that when my fingers don't poke underneath the drape. And lastly, our iron, bringing our ulna down, making sure that it's in front of us and not underneath us. Getting some of the medial leg, the anterior surface, and also some of the lateral surface. Great, and with that, we've got the quadriceps taken care of as part of our circulatory. We'll go ahead and move on to the next spot. Okay, so we're ready for the next step of our recipe here. We're going to be working on the adductors next. Now we're going to start with the body in the neutral position, but what we're going to do is we're actually going to bend the knee, and as we lay the leg open, we're going to make sure that we have the drape, pulling the drape snug on the inner leg. Now, when you lay the leg open, just keep in mind that some clients may not be comfortable with their leg just hanging out. If that's the case, you might use a bolster or a pillow to help support their leg. In this case, we're going to go ahead and kind of let the leg hang out on its own. And what we're going to start with is we're going to start with our palming strokes. So I'm just bringing a little bit more lotion into this area. Now when I do my palming strokes, I usually fold my fingers, so again, my fingertips don't try to go underneath the drape. My bow stance, as you can tell, is pointed in the same direction as my push. Okay, we're going to turn into our knuckles. You'll notice that from here, my knuckles is when I turn my knuckles straight down, so that's the difference between a palm with folded fingers and knuckles. Okay, from here we're going to use our trenching tool. Trench is a sharp tool with the palm lifted. It doesn't have to be a heavy amount of pressure. This is a great tool for tracing the lines or the borders between muscles and helping to create some separation or just some awareness. Great. Then we're going to go into our thumbing strokes. You'll notice again that I'm using my fingers folded so that way they don't poke underneath the drape as I get close to it. And lastly, we're going to do our ironing stroke. Great. Once you're done with all of those, we're going to take the leg, place it back on the table in a neutral posture, and we'll be ready for our next move. Okay, so we're ready to do the next move. We're going to be working on the IT band and the TFL. Before we do this move, what we're going to do is we're actually going to cross the legs at the ankles. So I'll bring the draped leg a little closer, take the undraped leg and set it over the top. Now the legs should be able to stay here, but if for some reason that you're finding them a little bit unsteady, you can use your offhand to kind of secure the legs in this position. Once we have the legs crossed, we're going to go ahead and be doing our palm knuckle trench thumb and iron on the IT band. Try to make sure you're doing full strokes all the way from just on the distal side of the knee all the way up to the TFL, or as far as your drape allows you. We're going to be doing palm strokes first. Good, moving into our knuckles. I know I'm mentioning this late, but my bow stance definitely pointed in the same direction as my push again, front forward, front foot forward. Trenching, next. Good, moving into our thumbs. You'll notice as I work through my thumbs, I'm going to take my stance and I'll actually step forward partially through this technique and then step back. And so kind of just like a typewriter or eating corn on the cob, once you're done with the stroke, you gotta step yourself back to the start. And then lastly, we can do an ironing stroke through here. Great. When you're done working on the IT band and the TFL, you can go ahead and uncross the legs, and we'll be ready for our next move. All right, so for our next move, we're actually going to bring the knee and the hip into flexion. When we do this, we're going to bring the knee up. As you bring the knee up, make sure you're keeping the drape tight. We're going to try to set the knee close to the glutes as much so as the client can be and be comfortable. Once we have them here, we can have a seat on the table. When we sit on the table, you always want to try to make sure you have at least 1 foot solidly planted on the ground. It's usually comfortable for the client if you do sit just a little bit over their toes. So you can always check with the client if you're concerned with whether or not that's okay with them. With the heel as close to the glutes as possible, we're going to bring our hands down as close to the ASIS as we can. And we're going to kind of scoop and we're going to scrape the quads. You'll notice that I'm leaning back kind of like I'm in a recliner. And we're just going to try to let our hands slowly creep up the knee. And when we get all the way back, we can almost hold this like a light stretch. It's very decompressing for the low back and for the hip. And if we want, we can come back through. We can do this move a couple times. Coming down to the ASIS, kind of cupping and scraping the quads as we lean back. And almost we could hold the knee almost like in a light stretch before we relax it back into the neutral. Once we've done that move, we're going to go ahead and roll the thigh. So this is just like you can see, just pushing forward and backwards on each side. I usually tell students not to be shy. You can definitely do some kind of vigorous rolling and shaking here on the thigh as we do this move. You'll notice my hands slide a little closer to the hip or a little closer to the knee to kind of spread the move out. Once we've done that, we're going to take our hands, we're going to use our palms to do squeezing, circling palms. This move can go in circles from the hip towards the knee. It can also go in circles from the knee towards the hip. And remember, in case the client's leg and your body, your hands are a little on the smaller side, you don't actually have to link your fingers. You can actually do this move even without having to link your fingers together. So don't let that be an obstacle. Great. Great. We've done those first 3 moves. The last move we're going to do is we're going to get back up. We're going to take the leg and we're going to unbend it a little bit, and we're going to jostle the gastrocnemius. So when we jostle it, don't poke at it and jab at it. Just lightly kind of shake it out and keep your fingers in contact with it. Great. And once we've jostled gastrocnemius, we'll set the leg back into the neutral spot and we'll be ready for the next move. Okay, with the leg back on the table, we're ready to work on the tibialis anterior. So we're going to go ahead and come down to the foot of the table. Our bow stance is going to be looking up. Front foot is pointed in the same direction as our push. A lot of times with tibialis anterior being slightly on the lateral part of the distal leg, we're just going to turn the leg very slightly to kind of give us a little bit easier access. And we're just going to go over this with a few palm strokes. So I usually start way down at the ankle and then bring my palm stroke all the way up. Then we'll go into our knuckles. Then trenching. Thumbing here. And this spot's a little too bony and small for us to use our iron, so we're going to move on to the next move. We're actually going to turn the leg even more lateral so we can get the fibularis muscles, and again we're going to palm. Bow stance is in the exact same direction as before. Really make sure that you're on the very side of the ankle. Knuckling next. Then trenching. And finally, thumbing. Great. Once we've done that, last move we're going to do in the same posture or in the same stance is going to be a trenching of gastroc. So we're going to take our hands and create a hook with the 2 fingers together. And we're going to drag it down the backside of gastrocnemius a few times. Remember that you don't just have to get the center. You can actually take that hook and kind of turn it and get one side, turn it and get the other side. So you don't have to just do the back and the center. You can actually do the back and the sides as well. All right, great. So those are the 3 moves that we can do out of this one stance at the foot of the table. We'll be ready to move on to our next step after that. Okay, so we're ready to address the foot here, where the next move that we're going to be doing is called shearing the metatarsals. So we're going to take our bow stance and actually face it down the table, front foot pointed towards the foot or down towards the foot of the table. When we do this move, I want to caution you, we're not trying to grab the toes and wiggle the toes. We're trying to grab the metatarsals and move the metatarsals. So be mindful that you really want to grasp the foot and not just the toes. So what we're going to do here is we're going to take our one hand and we're going to just grasp the big toe. We're going to take our other hand, we're going to grasp all the other metatarsals, and we're going to push and pull like we're trying to wiggle some space in between those two. You'll notice I'm trying to twist my shoulders a little bit to give my to put some movement in my body so my arms don't have to do this by itself. Once I've done the first one, then I grab 2 in the right, 3 in the left, and I do my shearing for the second set. Great, then I do 3 and 2, continue shearing, and then 4 and 1 to finish this off. Okay, once we've sheared the metatarsals, we're going to move on to the last move of the first leg. We're going to stand at the foot of the table. Bow stance is going to be facing towards the head. And what we're going to be doing is grasping the ankle to create a traction. When we create a traction in the foot, you want to try not to pull from the heel and the foot. That can put discomfort into the ankle. Instead, we want to look where the ankle bones are, and we want to try to grasp proximal or closer to the body. So when we pull on this, it doesn't feel like the pull is coming through the ankle. If the ankle's a little slippery because of the oil or lotion they've been using, you can use the other sheet to wrap around the ankle. Should make it easier for you to grab. Okay, so I have secured the ankle. I'm going to go ahead and kind of grasp the foot. I'm going to hook my palm underneath the heel. And I'm going to use my stance like I'm sitting into a seat to create my traction. I'm going to rotate the hip laterally, and then I'm going to push and rotate medially. And we're going to do this a few times. Traction in my stance, rotate medially, shift forward in my stance, rotate medially. Traction back, rotate lateral, push forward, rotate medially. Once you've done this a few times, you can unwrap and you can re-drape this leg. You're ready to do all the moves that we've covered so far on the second leg. Once both legs have had all of these movements done, there's one more move that we'll do to end this, which you'll see in just a second. All right, so for the last move, we're going to be doing a movement that requires us to kind of give the client a little bit of instruction. First, we're going to need to drape both legs. So I'll go ahead and undrape the first leg again. Once we have this leg draped, what we want to do is we want to guide the client's hand onto the piece of drape that they are going to hold onto. So this drape that's coming underneath, we're going to go ahead and place their hand on it and just let them know that when we bring the knee and the hip into flexion, they're going to lightly pull on that drape to keep the drape snug on the inside of the hip. So I'll go ahead and come around the table and we'll do this on the second leg as well. Okay, making sure the drape's secure over the top of the body. The hand is on the drape underneath. We can bring the legs up into the flexed position now. And at this point, what we're ready to do is to come up onto the table. Now, when we're on the table, I want you to remember the safest and stablest way for you to be on the table is to place one knee down on the table and one foot down on the table. This gives you the best balance, and it also gives you the ability to move on the table. It is better than placing both knees on the table. So try to remember to try to get one foot down here. When we're ready, we're going to raise the client into a flexed position, placing their feet on our chest or on our belly. We're going to grab their knees, and we're going to pull their legs into us. Once we have them locked in this position, we're going to turn and we're going to rotate through the hips. And we can go in both directions. We can stay in some place, like especially in this deep center position, we can almost kind of stretch into it lightly before we continue our circle on the way out. When you're ready to finish this up, you'll just take the client's feet, place it back down on the table, and bring them back down into the neutral position. And then you can undrape and close the massage as you need. All right, so just in case, in some circumstances, you're not technically allowed to be on the table when you're working in certain areas, or you may not necessarily feel comfortable being on the table to do that last move, so we're going to show an alternative. Now in this case, what we're going to do, instead of doing both legs and both hips at the same time, we're just going to do one hip at the same time. When we do this, we just need the one leg undraped. We can still bring the client's hand onto the sheet to grasp on that sheet and keep the drape snug on the inner hip. We're going to go ahead and bring the knee up and flex the knee and the hip. And we're going to grasp the foot. Sometimes you can grab the foot by the ankle and the knee. I personally kind of like to hug around the foot and control the knee. When you have the foot and the knee well controlled, you also control the hip. And from here, what we can do is we can push into that hip rotation just like we were doing it when we were controlling both hips at the same time. So again, moving around. You can sometimes even think of this as a light stretch. And when you're ready, you can return the client's leg back down to the table. And if you otherwise need to do something to finish your massage, you can do that now. But otherwise, circulatory routine, this is the last move here.